to the 4-part video series on understanding metabolic syndrome and treatment options in patients with type 2 diabetes, presented by Superior Health Quality Alliance. This recording was developed for healthcare workers with an interest in providing care to individuals with diabetes and metabolic syndrome. In this second video, we'll cover diagnosing metabolic syndrome. You may watch each video in order or based upon your interest. Our learning objectives are first to understand what causes metabolic syndrome, and next to identify components and criteria in diagnosing metabolic syndrome. So what is metabolic syndrome? Well, it's a health condition that comes from a mix of different causes. In many cases, it's due to a combination of genetics, lifestyle choices, and other factors. These lifestyle factors include obesity, which is usually a result of not having enough physical activity and not maintaining a healthy diet. People with metabolic syndrome are 5 times more likely to develop diabetes. The recognition, treatment, and prevention of metabolic syndrome starts by doing a history and physical. The encounter should start by weighing the patient and taking their blood pressure. In this example, I walk into the room and I greet the patient. "Hello, I'm Dr. Newman." Mrs. Jones is sitting in the room, and all I'm doing is just looking at her and recognizing potentially a diagnosis of metabolic syndrome just by her waist circumference. I ask her what her life is like, are you walking, and so on, and all I'm doing is actively listening. I notice her high blood pressure reading, and I decide to retake it because now she's had some time to rest in the room. And again, notice that it is still high, along with her weight. So now I'm starting to put the pieces together. I've got abdominal circumference, I've got some high blood pressure, and a high weight. She's also looking a little disheveled. So now I start asking her about her social history and lifestyle. It's a casual conversation to put her at ease. Here are the 5 criteria used in diagnosing metabolic syndrome. Waist circumference, so more than 40 inches in men and 35 in women. Elevated triglycerides, and that's a bad cholesterol. Reduced HDL, which is your good cholesterol, so less than 40 in men or less than 50 in women is not good. And elevated fasting glucose, such as 100 or greater, and your blood pressure values, a systolic reading of more than 130 or higher, and a diastolic of 85 or higher. The primary diagnostic components are high-density lipoprotein, that's the good cholesterol, triglycerides, and fasting glucose. All of these components relate to weight and weight gain, specifically intra-abdominal ectopic fat accumulation and a large waist circumference. Most of the disorders associated with metabolic syndrome don't have obvious signs other than a large waist circumference or symptoms unless the blood sugar is level is high. And then you might notice symptoms that are associated with that, such as an increased thirst and frequent urination. The etiology of metabolic syndrome relates to obesity differently. It involves both extra weight and adipose tissue. Most providers rely on the BMI tool, which calculates your body mass index using your height and weight to determine whether a person has normal and overweight or obesity. It's an easy and inexpensive measure. There are also lifestyle issues, such as a lack of physical activity or it can be gender, ethnicity, medically significant family genetics, and the expected accumulation of fat with aging that can all play a role in metabolic syndrome. The distribution of the body fat plays a role. The picture that I would like for you to see in your head is the body shape. Is it more like an apple or a pear? The apple-shaped patient carries their weight in their midsection, putting them at a higher risk than the pear-shaped person. However, both are known to play a role in the development of metabolic syndrome. Upper body fat plays a strong role in developing insulin resistance. Again, that's the apple body shape. And that is, which means your weight is pushing up on your diaphragm and affecting your sleeping and your breathing. Fat accumulation can be visceral fat or subcutaneous. So if you have the apple-shaped body, you probably have some fat around your organs, like your liver. Visceral fat may contribute to insulin resistance more strongly than subcutaneous fat. The diagnostic tests ordered should include those necessary to determine if Mrs. Jones has diabetes and/or metabolic syndrome. So our basic metabolic panel will give us a picture of her electrolytes, creatinine, and blood glucose levels. This, along with the A1C and lipid panel, will give you a good clinical picture. Further studies such as C-reactive protein, liver panel, thyroid study, and uric acid can be drawn to investigate and support further the diagnosis of metabolic syndrome. In summary, the key takeaways are there is a direct correlation between obesity and metabolic syndrome. There are 5 criteria used in diagnosing metabolic syndrome, and a patient must have 3 or more of these criteria to be diagnosed with metabolic syndrome, regardless of whether they have diabetes. And finally, making a diagnosis is a combination of visual observation, physical exam, and diagnostic testing. Our next video in the series, Partnering to Improve Diabetes Management, Video 3, Treating Metabolic Syndrome and Diabetes, will cover treatment options for metabolic syndrome and diabetes. Here are tools and resources to further explore what we've covered in this video. If you have questions about this video series or others, please contact us at info@superiorhealthqa.org. Thank you.